So for me, I work 4 days a week from 8:30 to 4:30, but we do provide a 24/7 round-the-clock service to patients in Medway and Swale. My day starts and ends with a handover with the nurses on our 15-bedded inpatient unit. And then during the day, my team and I conduct a ward round of the patients, talking to them, talking to their families and making any changes to their medications that might be required. Then we'll have admissions, so they'll be from the community, so the areas of Medway and Swale. But we also take admissions from hospitals, mostly Medway Maritime, but other local hospitals as well. And my team will always make sure that they're comfortably bedded into our unit.
We are comprised of 5 clinical nurse specialists, 1 specialty doctor and an advanced care practitioner. We offer specialist advice to the wards for patients with a palliative diagnosis. We offer symptom support, pain, nausea and vomiting, and other symptoms as well. We also offer discharge support, particularly for end-of-life patients and getting them to their preferred place of death. That involves lots of difficult conversations with relatives and carers, and we support the wards with those as well. We also facilitate discharges to the hospice for symptom control and end-of-life care, and we liaise with the community palliative care team for seamless transfers in and out of the acute setting.
Our team is a team of specialist social workers, counsellors and welfare advisor. And together we seek to provide psychosocial, emotional, spiritual, financial and social support to patients and their relatives and carers and families under the care of the Wisdom Hospice. We can work individually, one-to-one, with patients or their family members and carers, either in their own home setting or through appointments here at the hospice or via telephone contact or Teams contact. So we seek to be person-centred in our approach in meeting the individual in their most favoured environment, which is most supportive and helpful for them.
So our teams are made up of social workers and counsellors, and we also have a team of volunteer bereavement counsellors that come and support us. We work with patients and their family members. We do lots of work with children, and that's usually in around the last year of a patient's life. So we're working in schools or here at the hospice, out in the community, just to support people with anything and everything, really.
Hello, my name is Dexter. I'm one of the advanced nurse practitioners working in the community palliative care team. I give support and advice to the junior members of the team, the community palliative care team, and also represent the medical team within the CPCT. I also cover the inpatient unit when there's a shortage of doctors on the inpatient unit. The role of the community palliative care team is to support the patient and their family when they're at home. And a member of the community palliative care team will do an initial holistic assessment to ascertain what the patient needs are, and then we will refer them to teams within the hospice or in the communities, other community services to meet their needs.
We are a 15-bedded unit. Our beds are mainly in bays, but we also have 3 side rooms. As well as dedicated nurses and healthcare assistants, we also have a therapy team who see our patients both on the ward and in their own homes. On the ward, we care for patients with life-limiting conditions such as cancer, motor neuron disease and Parkinson's, to name a few. Our patients can be admitted to the unit for either symptom control, palliative care or end-of-life care, dependent on the stage of their illness. Recently, we started to roll out the Namaste programme, which originated in dementia care. This has been rolled out across different areas of health. Namaste strives to consider the spirit of the person within, whatever that may be. For example, acknowledging all the senses, what makes them unique and how we can support them to live as well as possible for as long as they are able.
Yeah, so I'm a relative, so my brother's here, he's 50 years old and he has terminal cancer, and they've been absolutely amazing. My brother's been here for a week now, and it's such a different environment to hospital. It's much calmer, it's much more person-centred, so they really understand my brother. And then from a carer's point of view, so we had a family meeting the other day. I'm the next of kin for my brother, but I felt it was really important that my family, my sisters, my mum and dad were also involved in our brother's care, so that they were also aware of what the options were, so that we could have a collaborative conversation, a collaborative discussion with our brother's needs at the centre of everything we do, but that we agree and we're all on the same page. And of course with the medical and nursing staff as well.